Hello, everyone. Good evening. Welcome to our patient health workshop. And we are about to begin. So, if you have not yet jumped on, I don't know how you're going to get this message in order to jump on, but try to jump on and join us as we are going to discuss the topic for today, the 7 keys to getting and staying well. So, let us see who's on. So, I hope you're all hearing me, and if you can just quickly indicate in the chat that you are hearing. So we have Ava, Jackie, Jermaine, welcome, welcome. Felicia, welcome. So we're about to get started. Now, I'm excited about this class because it's always a pleasure being able to share information with you, the public, and with patients of ours. But I look forward to being able to spend a little time with you this evening and see what information we can come up with. And I'll try my best not to be too controversial. So I try to stick to the script as much as possible as we go through our topic for today. So, as I indicated before, the topic is the 7 keys to getting and staying well. The 7 keys to getting and staying well. I'm going to try to see if I could put up for you um, a link that you can use. If you go to the chat, I've just included a link that you can use to download the handout for the class. So feel free to download the handout for that class. Hi, which C is this? Is it Charmaine? Well, good evening. All right, so in fact, what I will do is I'll put up on the screen here the a QR code that you can just simply scan to download the information as well. So if you were to scan this, it will give you the information that you will need as well. So I'll give you a moment to just get to the QR code and scan it to get in that info. All right, I think I've given enough time. Hopefully you'll be able to benefit from it. Let me just quickly also remove my image so you can see even the information that is there pertaining to the Google Drive URL. So if you'd prefer to do that and copy it from there, you're welcome to do that if your QR code isn't working. So you can copy that information that's there. Give it a couple more minutes. It's also in the chat. So you could go to the chat and download the information. All right. Sounds good. So let us begin. So we're going to be discussing the keys to getting and staying well, which are, I think they're important information that each of us will need to have at our disposal so that when we're interacting with the healthcare community, we A, understand what's going on with our bodies enough that we can ask good questions, and to ensure that whenever a recommendation is made, we have a framework within which to interpret that recommendation so we can have a better idea to see if it's a recommendation that we would even agree with. Gone are the days when the patients are seen as the children and the doctors being the parents. It's not a parent-child relationship anymore. It's a more collaborative relationship. And it is important that I think that the general public understands enough about healthcare, understands enough about their bodies, so that they can participate in the decision-making process more than just simply to say, follow what the instruction is that your doctor is giving. Because sometimes those instructions are at odds with what you would like for yourself, and then you are angry with yourself for going along with something that you otherwise would have not agreed to, especially if there's a negative outcome at the end. So the first key is understanding sick care versus healthcare. Sick care versus healthcare. And one of the things is that the primary difference between the two, and as I go through, you'll understand what I mean by sick care and what I mean by healthcare. The primary difference between the two is that sick care, or caring for the sick, is reactive, which means that the current model that hospitals operate on, or the current model by which healthcare facilities, whether it's a clinic, in an infirmary, whatever it is, they operate on a reactive model, which means that something has to go wrong first, and then you will respond, hopefully appropriately, to whatever it is that's going on. So we have to appropriately respond to whatever the issue is so that we can make an appropriate answer or response to the situation. So here we are. Whereas sick care is reactive, true healthcare is proactive, which means that we can't simply wait until something has gone wrong before we intervene. We have to make deliberate choices beforehand so as to prevent something from going wrong in the first place. This is what we call proactive or preventative. We're trying to prevent a negative outcome by doing an action beforehand. And so this is key, this is important, and this is how we really should start thinking about living. But despite all of that, we are in trouble because we are living in a crisis as it relates to healthcare, where the number one reason that persons are going into private or personal bankruptcy is because of some kind of healthcare costs. I mean, you're going through life, seems fine, you have a good job, you have good insurance, and then all of a sudden you have a life-threatening condition that puts you in a situation where you are now at risk of a very poor outcome. And so we do not want for that to happen. So we have to make choices that are in line with what makes sense. So for example, if it is that we are having a crisis in healthcare because we have too few beds, we have too many sick people, we have the majority of persons in a hospital setting are there because of decisions that they made for themselves. Most of the issues that happen that cause us to be sick has very little to do with trauma. The number one reason for persons to be sick and have to visit a hospital setting is because of chronic lifestyle diseases. You have a disease issue that has been there for a while, and you end up needing to be hospitalized to address it. Drugs and surgeries can never be the solution for a lifestyle problem. And I'll repeat that, so please listen. Drugs and surgery cannot be a solution to a lifestyle problem. If you have a problem that's caused by a lifestyle issue, you need a lifestyle modification solution. And this is very important. Now, if we want to have a chance of having good outcomes as it relates to our health, we have to have a good mindset, and that mindset begins with the way we think. Now, there are two general ways that people think as it relates to healthcare. The two ways are one, according to the illness care model, and the second way is according to the wellness care model. So, true wellness, which is what we're proposing the allopathic approach is versus the naturalistic approach is versus the allopathic approach. And the allopathic approach is treating the individual parts as being greater, or the sum of the individual parts being greater than the whole. So we do not focus on the holistic side of things. We're focusing on individual components. The problem with that is that these individualized components can result in us having negative outcomes. So if we're not careful. So let's begin to look through the different ways that we think and see if it can make some sense to us. The first way is, if something happens to us, our first thought is, what can I take? If we're asking the doctor the question, Doc, what can I take in order to feel better? Because feeling better becomes a priority for most of us because of how we're trained. And who is it that's doing this training? It is the pharmaceutical industry. They are the number one people who train us how to think as it relates to healthcare. And how do I know this? Because they are the ones who spend the most money on marketing. And it is these marketing efforts that result in persons having a mindset that is driven by the illness model. But beyond just feeling better because you have an ailment, how about asking a different question? Let us say you have a headache, for example. Rather than saying, Doc, what can I take to feel better? Why not ask a different question? Doc, what can I do in order to get better? Because getting better is far more desirable than simply feeling better. We want to feel better, yes, but we don't want to feel better for feeling better's sake. We want to feel better because we are doing better. Things are working out better. We are living more appropriately. So these are all important. Next thing is getting well. I don't know if any of you has ever used this expression of get well, like get well soon, as what we would say if somebody's in a hospital. The get well soon notion is not the greatest for us because it presupposes the idea that the destination is far more important than the process. And what's the destination in this case? Wellness. People want to just drop into wellness. They want to just achieve or attain wellness. They don't want to go through whatever steps are required to develop into wellness. They want to just arrive at wellness. So they want to get well, as if it's some magic potion or some light switch that you flick, and then all of a sudden you now have wellness. No, that's not what we want to do. What we want to do is we want to appreciate the journey. So rather than simply saying, what do I need to do to get well? How about asking a different question? What do I need to do in order to stay well? Stay well. That is so much more important. The next thing is staying alive. And persons, according to the illness model, in error, think that the longer a person lives, or the older the average age of a population or the life expectancy, the healthier the society. Whereas it is true that there are certain conditions that will lower our life expectancy, our life expectancy is not an accurate measure of the health of a population. So this is very important for persons to start to realize. And the reason it is so is because in order to get life expectancy numbers, the number one thing that can impact your numbers for life expectancy is not how old your oldest population lives. What impacts the numbers more than anything else is whether you have children dying in childbirth or dying in infancy. Because if you have a child dying, let's say you have 2% of the population or 3% of the population dying as an infant, then that means that 2% of the population are going to be missing out on 30, 40, 50, 60, 70 years of life. And let us say the people who are 100 years old in our society is also 2%. Then they are only living, let's say, 20 years older than the average age would be. So in the one case, you'll have children who would be living 70 or more years less than the life expectancy if they die in childhood, versus those who would be 100 and live only 20 or 30 years over the average life expectancy. So the impact of keeping your young children alive will be far greater to your life expectancy numbers than it would be for your old people living longer. And this is what most people don't realize. And so you find that some societies where they have life expectancies in the 80s and another society where they have life expectancy in the 70s, it's very easy to assume that the first case where the expectancy is in the 80s is a healthier population because the life expectancy is longer. And that's not necessarily true for the reason I just outlined. So I hope that makes some sense. A better measure of how healthy a society is and what is a preferred way of looking at the life is really not simply whether you're going to stay alive, but is whether you feel alive. Because in my opinion, it doesn't make sense you're living for a long time if you don't enjoy the quality life that you ought to be enjoying. And that is very important. Very, very important indeed. So in looking at the whole issue of the two ways of thinking, it's a very subtle shift in your mindset to get you from the illness way of thinking to get you to the wellness way of thinking. And that is, instead of feel better, get well, stay alive, it is get better, stay well, feel alive. So instead of feel, get, stay, it is get, stay, feel. Very important. But the second key is, what is the truth about pain? Can we trust pain? Is pain a good measure of anything? Is there a purpose for pain? Is pain good? Is pain bad? And some of us would probably think to ourselves that pain is a good thing, and some of us would think that pain is a bad thing. And I'm sure there are arguments for both. But what we can all agree on is that there is a purpose to pain, is there not? Pain serves a very important role. The role of pain in our lives is that pain alerts us that something in our systems, something in our bodies has changed and requires our attention. This is very important. Something has changed and requires our attention, but there is a limitation to pain, and the limitation to pain is that you can't always trust pain to tell you the truth. In other words, you can have a severe life-threatening disease and pain fails to warn you that that disease is there. And a very good example of this can be seen in the case of cancers. Most cancers in the earlier stages do not have pain associated with it. It is only in the very late stages that pain might be associated with some of these cancers. And so persons may have cancer for years. They may see a swelling, see a lump, see a discoloration, and because there's no pain, they don't think it's serious. So that's important. The second thing is having good health is not equivalent to feeling good. Simply feeling good is not enough, because you can feel good and be very sick, as is the case of many people who are going to die of a heart attack tomorrow while they feel good today. And this is the reality that we face. Now, good health does mean healthy function. So if your body is working properly and our functions are appropriate, then good health ensues. It makes sense. So what we need to start doing is figuring out how do we focus on measuring or tracking our function, the functions of our health, our healthy cells, our function of our bodies, rather than simply just waiting to feel good. So the bottom line is we need to start trusting function and not feeling. Function and not feeling. So if we were to look at all the systems of the body, look carefully now, you will see of these systems of the body, they are all individualized systems, but they all communicate with each other to varying degrees. For example, our cardiovascular system does not work without our respiratory system at all. And so they are intimately related to each other. Our endocrine system does not, or the reproductive system does not work well without our endocrine system, because how our hormones are secreted and how even our sex fluids are secreted are dependent on our endocrine system. But of all of these systems, there is one system that we consider to be the master control system of the body, and that's because this system directly controls and regulates the functions of all the other systems. My question is, which system is this? Which system has the responsibility to cover over or to address or modulate the function of the other systems? So somebody says the central nervous system, and you're almost right, Aaron. So I will modify your answer just a little bit because while you're partly correct, it's not specifically just the central nervous system. But as Carl is now pointing out, and Carl has retracted, but he was correct, it is the nervous system. The nervous system is the master control system of the body. Because all the nerves that travel through the spine has to go through out between the bones to go to the organs that they control. So I'm going to try to see if I can show you. So if you were to look, you will see the different systems of the body. And you'll see that there are organs that are associated with every nerve. These are the nerves that travel from the spine to control the different organs of the body. Whether it's your respiratory system, your cardiovascular system, your endocrine system, your digestive system, your excretory system, your reproductive system, all the systems of the body are controlled by the nerves that exit the spine. And this is very important. So let's continue, shall we? So, in the event that you have a bone that's out of place in your spine, it can impact the function of your nervous system because the nerves have to exit between these very bones. And so, if a bone is out of place, it may potentially impede the function of a nerve by direct pressure on the nerve or by creating local inflammation in the area, resulting in the nerves not firing properly. So this is how vertebral subluxations work. And this is what a vertebral subluxation may look like. You have vertebrae, spine. The bones of the spine should all align with each other. If you look here, you'll see that this middle bone is not aligned. Because it is now pushed in relative to the bones around it. By pushing it in, these openings in the back where the nerves would normally exit now come under pressure. These nerves now come under pressure, and I can show you. This is the opening. If this bone is pushed inwards, the nerves that's supposed to be exiting that bone becomes compressed right here. And whatever this nerve controls itself will now be compromised. I hope that makes some sense. Let's move forward. Now, there are 4 types of stressors or 4 types of stresses that we encounter as we go through day to day. The 4 types of stresses occur in one of the 3 dimensions of life: the physical, the biochemical, and the psychological. I know some will say there is also a spiritual dimension, but for our intents and purposes, I am combining it under the psychological. Because these are things that are not tangible things, right? So, for example, the physical means car accidents, falls, traumas of a physical nature. The biochemical stressors are those of a chemical nature, like the purity of the water that we consume, the foods that we eat, the medications that we take. All these things fall under the biochemical. And then the psychological stress will be those things that fall under the emotional things. So, for example, you have a rough relationship at home, or you have had a strained relationship at work. Whatever it is that's creating a psychological strain for you is part of this psychological stressor. The healthier our nervous systems are, is the better we're able to adapt to our environment. The healthier our nervous systems are, the better it is that we're able to adapt to our environmental stresses. And this is a very important thing to realize. So, in this key number 5, I'm going to try to explain why it is that we get sick, and hopefully it makes sense. So I'm going to remove my image here because it's going to be in the way. Because I want to talk about our general adaptive potential. Our general adaptive potential is the potential that we have in our bodies, or the ability that we have in our bodies to cope with our environment, to adapt to our environment. And so as we go through, check this out. And we're using an actual gap as the analogy to explain this gap theory, this general adaptive potential. A gap will have a lower limit, and obviously then it should also have an upper limit, wherein the space between the two represents the gap. The wider the gap is the higher the upper limit goes, which means it approaches vitality. And as the upper limit falls down towards the lower limit, the gap narrows and you approach death. Now, our environmental or our external stressors are the things that push down on our upper limit and cause us to potentially break down. But then we do have a resistance built in We call it our internal resistance that counteracts the effects of these negative responses. Now, our life experiences occur in the 3 dimensions, as we talked about. And if in any of those dimensions, our ability or the experience that we have in our life exceeds the upper limit of our ability to adapt, then we are going to break down at that point. But as long as all the experiences in our lives exist within the boundaries of our gaps, we do not break down, we do not get sick. But if we continue to allow our external stressors to become so great and we lose the quality of our internal resistance, lack of sleep, what have you, then you will find that the upper limit will start to fall. And when it now lowers the potential, our gap narrows, and some of the things that we were once able to cope with, sometimes quite easily, we're no longer able to cope. And everywhere where our experiences exceed our upper limits to adapt to it, this is where we break down, this is where we get sick. So I hope that makes sense. So all in all, this saying at the bottom of the screen is a very important one. It says, our ability to adapt is determined by the width of our gap. Our ability to adapt is determined by the width of our gap. The wider our gap, the better we can cope with our environment. Let's continue. Now, how does chiropractic work? Chiropractic is interesting because the way chiropractic works is that the healthier our nervous system is, the wider our gap is, the healthier we are, the better we can cope with our environment, the better we're able to overcome the stresses in our environment. And it's not to say that we can always, just by being healthy, maintain a gap wide enough so that there's no stressor that could cause it to falter. Because the reality is, there are certain types of stresses that no matter how much we are prepared for them, just the limitations of physical matter dictates that there are some stresses that we can't overcome. Like if you fall off a very high building, it's more than likely that you're going to be hurt. Now, chiropractic by itself is not adequate to widen our gaps. But chiropractic is a good tool to help. So, you will not expect to be fully healthy if you're just getting your spines adjusted while you're living and eating poorly. And you're not getting any rest, you're not having good relationships, you're in a negative state. That's not appropriate. What's more appropriate is, in addition to all of those things that you're doing, you get your chiropractic care, because the chiropractic care, in conjunction with those things, will help to widen your gap. And this is how it works. So let's go back to this one. It says, key number 6, we're winding down now. In our office, we have invested in specialized technology that assists us in determining the presence and location of subluxations within our spines. There are 2 specific spinal scanners that we're using. One that measures the temperature of the skin along the spine. And wherever there is an issue in the spine, it may affect, it doesn't always, but it may affect the temperature of the skin. And if it does, we are able to pick up this change using this device. called a rolling thermal scanner. And then on the left hand side, we have the surface electromyography paddles, surface EMG, which measures muscular activity. So it measures the electrical activity within the muscles. So the question is, what kind of doctor is a chiropractor? It's a question that people often ask, right? So if you don't know before, did not know before, I'm going to try to explain to you now. A chiropractor is a specialized kind of doctor, right? And what we do impacts the nerves. And what it is that a chiropractor primarily does is we impact the nervous system by way of using our hands or a handheld tool to realign the bones of the spine. Therefore, if a bone is out of place, causing irritation to a nerve, as long as it's not totally dislocated, we're usually able to use our hands and shift things back in place. But the effect of this shifting things back in place is several-fold. Yes, things are aligned, they will move better. But when you move the bones, these bones are connected to very sensitive nerve endings that directly connects back to the spine and gives the spine feedback that it needs to recalibrate the control that the brain has over your environment. And so, as long as your connection to your environment is good, your brain will send a signal that should be appropriate to the needs of the body, to the environment that it's in. So this study was done where they were testing the effectiveness of chiropractic adjustments on somebody's brain function. And what they found was interesting. So before and after an adjustment, a lady was asked to wiggle her left ankle. She performed the task, and a functional MRI was done of her brain before she was adjusted, and again after she was adjusted. And what you will see clearly is that in the image, and I'm going to try to see if I can zoom in a little bit. So in the image, what we now see is before the adjustment, we have multiple areas of lights acting up within the spine, within the brain. Each of these areas of lights represent an area of brain activity. The left ankle does not require or should not require all of the brain to be lighting up. That means a lot of wasted areas are involved in that task. And that's probably large in part to the brain and the body not in good communication, so it's an inefficient response of the brain. Well, in this side over here, after the adjustment, you now see that when she wiggled her left ankle and the brain was imaged, it's only a part of the brain that was demonstrated to be active. And that part of the brain actually corresponds to the parts that are required for the motor control of the ankle. That's the motor strip. So, as we're looking at it now, if somebody were to ask you, what is a chiropractor? Please do not say a chiropractor is a bone doctor, because what we do as chiropractors impacts the nervous system far greater than it does the bone. We just happen to make contact on bones, usually, not all the time, but usually make contact on bones or contact on the joints to influence its position relative to the bones around it, and thereby create the changes that are seen in the brain. Dennis, I'm not taking you on tonight, you know. Dennis is asking, what stimulates neurogenesis in the hippocampus? Can't answer that question, Dennis. I don't know the answer to that question. So you win this time. I don't have a good answer, Dennis. Not one that I don't have to look up. That one I'll have to look up. I don't even know if I ever knew the answer to that question to be able to even answer it honestly. What stimulates neurogenesis in the hippocampus? All right, let's continue. Now, what about chiropractic neurology, right? Chiropractic neurology is the branch of chiropractic that involves working with the brain and spinal cord more directly. Whereas the therapies that we put people on, the programs that we put people on are designed to improve their brain function or spine function. And this, how do I say it? This is different from medical neurologists, where a medical neurologist, the way that they intervene is by way of medications, usually. So a medical neurologist will most of the times use a medicinal intervention as the way that they're going to treat a neurological condition. Whereas a chiropractic neurologist is also considered to be a functional neurologist, where the way that we impact the brain and spinal cord will be by way of exercises or therapies that are targeting the areas that we're trying to stimulate. And it works pretty well, actually. There are many people who have various conditions that when we work on it, using just simple exercises based on knowing what each area of the brain does and just coming up with an approach that can address it, we will find that they can oftentimes, the body is able to help them to heal on its own without too much input from us, which is what we're hoping for. Now, chiropractic neurology is a subspecialty within chiropractic. All chiropractors are trained to realign the spine, whereas chiropractic neurologists also are equipped to retrain the brain. Now, what are some of the conditions that we treat in chiropractic neurology? These are some of the common conditions that we see. And these are some of the conditions that I personally have treated. I mean, I've treated somebody with every single one of these conditions. Most of them successfully in the sense that the person improves, but not all of them. So it's important to understand what our limitations are and work within that. Now, the Garden chiropractic vision here is simple. It's threefold. One is to be able to identify subluxations wherever and whenever they happen, and we use our chiropractic analysis to arrive at that. We provide persons with a program of chiropractic care. Put people on a program of chiropractic care to address their individual functions. And a program is usually several visits. It's not one visit. One treatment not going to undo everything. Usually put people on a program to address most things. And the last one is to educate our community on how to live healthier lives so that they will subluxate less. And the idea behind that last one is why we put together events like these where we're teaching how to be healthy, and we want you to be able to make good choices for yourselves, right? We do this class. We have a radio program that we have on RGR at 8 p.m. Jamaica time. That's RGR 94 FM. So that is important. So there's a question on the floor. The question is from Carl. How do you treat someone with ADHD? All right, how do I answer this one in a straightforward enough manner that it gives some information that's useful, while helping you to understand why I can't just answer this question straight out, right? there are three types of ADHD or three types of ADD, attention deficit disorder. The three types are attention deficit disorder, the hyperactive subtype, or attention deficit disorder, the inattentive subtype, or attention deficit disorder, the mixed subtype, which is a mixture of the inattentiveness and um, the what do you call it? The impulsive type. I think it's impulsive. I had said somehow it doesn't feel right, but the yes, the one that is impulsive, they do things and that you can't control. They can't control themselves, and the other one is inattentive. They are easily distracted and can't get back their attention. I have the inattentive and impulsive type, so I'm a mixture. So how you treat them is not substantially different because it's usually the same parts of the brain that are involved. The primary part of the brain that's involved with attention would be your frontal lobes. Being able to attend to something. You know, when you attend school, attending school, you know, you go to school, right? When you attend an institution, you are enrolled in that institution. You don't go to any other institution. That is where you belong. That is where you get your training. That's where you get your education. So, attention speaks to attending to something, meaning that that's what has your focus. This is what you're observing. This is what you're paying attention to. Something else in the periphery does not get your attention because this is what you're attending to, right? Your ability to attend to something is largely dependent on the frontal area of your brain called the frontal lobes. If that part of your brain is not working adequately, then you're not able to attend to anything fully. So you may, in spurts, focus on a task or focus on an item or focus on something, but then soon after that, something else gets your attention and you're gone to that other thing. And you may or may not ever remember to come back to that first thing. All right, so this is kind of how ADHD works. So, one of the ways that we treat persons with ADHD is by doing frontal lobe exercises. And these are, if you suspect yourself of having ADD, right? Attention deficit disorder, where there's hyperactivity or inattentiveness, um, the in either of those cases, we want to make sure that you are doing appropriate things to improve the situation. It is best if somebody can identify specifically where the issues are and what the exercises would need to be that's appropriate for that person. But you can always do Google searches on just hearing this. If you have already been diagnosed with ADHD, then simply reviewing to see what are some frontal lobe exercises that are beneficial for me to use to help to organize myself. So this is very important. All right, very important. Now, the last key is taking responsibility for health and well-being. The key to success in getting and staying well is for us to take responsibility for our health and well-being. Your faith, your health, and that of your family is the responsibility of who now? Who's responsible for your health and your family's health? Well, we are each responsible for our own health. If we're an adult and are able to make rational decisions on our own, we are responsible for our own health. If we are adults and we are incapacitated somehow by some ailment and we can't decide for ourselves, then whoever has power of attorney or the ability to adapt to or the ability to make choices that benefit ourselves, our families, or our children. If it's an older adult that can't take care of themselves, we want to make sure that we provide them enough, whether it's information or assistance or whether it's personal or otherwise, to be able to walk alongside that person to help them to overcome whatever it is that they need to overcome. In schools, many kids have shadows that assist the children to be able to get the information that they need to get so they can learn. All right? So our responsibility depends on who we are. If we are a child, our parents are responsible for our health. If we are an adult that can think clearly for ourselves, then we are responsible for our own health. And if we are an adult who cannot think for ourselves, then somebody else is responsible and we have to defer to them. But it's very important that we understand these things, right? This video here with me is a video testimonial, which is my favorite video testimonial. And if you go to our website or YouTube channel, you will see this and other videos there that you can make most use of. So just to now close off, we have a special offer for you. And the special offer is for appointments made tonight only. That is, having watched this video, we're going to suggest that you follow it up by sending an email to our office so that you can know how to take the steps necessary to address whatever it is that we're trying to do here. So in this case, we're trying to see those persons who might be interested in becoming a patient of our office. If you are interested in becoming a patient, then you will need to, having watched this video, go to your URL or go to your email browser or your email, whatever it is that you do your email through, and type in appointments@gcnjamaica.com and send us an email indicating that email that you would like to take advantage of the special offer that you saw on our program, on our online class, so that you can benefit from it. All right? So appointments@gcnjamaica.com. You will get a 40% discount off your new patient examination. And this only applies to persons who have not already had a new patient examination. If you've had a new patient examination, you are not considered a new patient. You are considered an existing patient. And for existing patients, you have a different offer. You will receive a 20% discount off your update examination. You also receive a 20% discount for every referral that you make. You'll get one treatment, 20% discount off one treatment for every person that you refer. So if you refer 2 people, you can either get 2 treatments where you get a 20% discount, or you get 40% discount off one treatment. Same way that the numbers work out. All right. The last one is you get a phase discount of 10% off the entire next phase of care. This 10% phase discount is important because it just kind of underscores that we need to, have in our minds to help people, because 10% discount off an entire phase of care is actually a lot more money saved than the 40% discount off one examination. So I hope that makes sense. So, as we indicated, we discussed the 7 keys to getting and staying well. I am your presenter. You can find our information at the following areas. I think we're also on Instagram at, I think it's Gardner Chiropractic. I might be wrong, but I think we're on Instagram as Gardner Chiropractic as well. So check us out on Instagram, check us out on Facebook, check us out on YouTube. Our URL for our website is gcnjamaica.com. gcnjamaica.com. Yeah. Now the question is, what does the 10% entail? The 10% discount of the next phase of care is this. There are 12 visits, generally speaking, for one phase of care. At the end of each phase, persons have an opportunity to determine whether they want to continue or discontinue. If you have already been a part of the first phase of care, meaning that you've already gone through 12 sessions, and you know that of the 12 sessions remaining, if you're on this program, this plan, this special offer, if you take it up, then the entire next 12 visits, you'll receive a 10% discount off the cost of the entire remaining 12 visits. So this is important because it is a lot more money that you will save than the 40% discount off the new patient exam. All right, and this only applies as a percentage discount when you have paid for the care. If you are doing it singly, meaning you're doing it after each session, then you'll get the discount after each session, but you won't get the discount as a lump sum money, for example. All right, so I hope that is clear. So thank you, everyone. It was indeed my greatest pleasure being able to share with you tonight, talking about the patient health workshop and helping persons to make wise choices for their health and the health of their families. And I hope that as a result of just the information that we've shared here tonight, you will make good choices going forward. Thank you so much, everyone. Do have yourselves a wonderful and blessed day, night, evening, whatever time it is when you choose to join us. Blessings to you and have a great day. Bye-bye.